Bismillahirrahmanirrahim. Assalamu alaikum dear friends. Hope you will be fine with good health. Now in this video of Pharmacology and Therapeutics, I will discuss about anti-anginal drugs. This is part 2. I am Dr. Abdul Malik, PhD Pharmacology, Assistant Professor, College of Pharmacy, University of Sargodha. If you have any question, you can write in the comment section. Please subscribe my channel for more updates, for more videos, and watch this video up to the end. So starting from the second part, here are the types of angina. You can see stable, effort-induced, or classic or typical angina. These are the other names of this stable angina. So usually last for 5 minutes. This is very simple and common angina type, and rarely more than 15 minutes. Triggered by physical activity, emotional stress, heavy metals, extreme cold or hot weather. Relieved by within 5 minutes by rest, nitroglycerine, or both can be given to this patient. Pain in the chest that may spread to the jaw, neck, arms, back, or other areas. These are the symptoms of basically stable effort-induced angina. May feel like the burning sensation of the heart burn or indigestion. So these are the basically symptoms of stable angina, and this can be treated by simple resting or with nitroglycerine. Now coming to the second type of angina, that is unstable angina. This is very unstable. We will see on the last about its figure what is the difference between the stable and unstable angina, and here is written in this form. So in the table form, are form of acute coronary syndrome. So basically often happens while resting. Basically this happens during resting condition or sleeping condition. It occurs suddenly. Feel chest pain, did not have before. This happened first time. This has not ever happened before. Discomfort lasts longer than stable angina, more than 20 minutes, more than 15 minutes, not relieved by rest or nitroglycerine. This will be the type of unstable angina. This is very dangerous form of angina. So hospitalization is essential for this type of angina. So episodes may get worse over time. So you can see the difference between the stable angina and unstable angina in the table. So the same each time stable angina, less predictable. Length of discomfort lasts for less than 15 minutes. Length of discomfort lasts for more than 15 minutes. Physical activity, exercise, or emotional stress are common causes of triggers. It can happen anytime, even during sleep. You feel chest pain you did not have before. So there is a difference, much difference between the two. There is another type, that is third type, that is variant angina, or we can call it Prinzmetal, or vasospastic, or rest angina. These are the other third type, caused by spasm in the coronary arteries. Basically coronary arteries spasm has happened there. Spasm can result in exposure to cold weather, stress, smoking, or medications, any other medication that is used for cardiovascular problem or other conditions, that may tighten or narrow the arteries. Basically this makes the arteries narrow, or there may happen spasm. Most people with the variant angina have severe blockage in at least one major coronary artery, and spasm usually happens close to the blockage. Basically this happens near to the blockage area. Usually happens while resting and during the night or early morning. Can be treated by medication. So this can also be treated by medications. And we go toward the other type, that is fourth type, basically called acute coronary syndrome or microvascular angina. This is emergency that results from rupture of an atherosclerotic plaque and partial or complete thrombosis of coronary artery. Myocardial infarction or necrosis is typified by increase in serum levels of biomarkers such as troponins and creatine kinase. Basically these biomarkers have increased in that person or patient. This may present as ST segment elevation myocardial infarction, non-ST segment elevation myocardial infarction. These are the two types in which ST wave is involved, and in other condition there is a no ST wave involved. So this can be as unstable angina. Pain is more severe and can last longer in exercise and resting. Nitroglycerine may not relieve the pain. So it is more common in women than men. So this condition happen more than 50 years of age or 55 years of age. So this is acute coronary syndrome. This happened basically due to metabolic syndrome. So here is the figure. You can see a difference between the normal. This is the normal coronary artery. Basically, flow is correct, easy, and lumen is empty. So, in other hand, we can see stable angina in which atherosclerosis has happened from both sides. This is equally. So, we can call stable angina. This is stable basically. This can cross, and we can block this one, open this one due to with the help of drugs, nitroglycerine. In unstable angina, basically this happened, and blood clot is also there. So blockage is very severe, and hospitalization is essential in unstable angina. In the other condition, variant angina in third form or coronary spasm, there is the spasm of the coronary arteries basically on both sides. There is a spasm and near to the blockage or any other form due to the drugs or any stress. So this is again another condition, and medication can relieve this one. This is a very dangerous condition, and hospitalization should be there in unstable angina. So coming to risk factors for angina, basically you can see physical inactivity, unhealthy diet, high cholesterol levels, high blood pressure or hypertension. If there is a hypertension, there is a multiple chances of angina. So smoking is another risk factor. Diabetes, people have double time the risk factor for angina and cardiovascular diseases. Overweight or obesity is another root cause of many diseases, and including cardiovascular diseases. Metabolic syndrome is another condition in which angina is very common. Older age and family history of early heart diseases. So you can see tightness or pain in the chest, and there is blocked coronary arteries in the heart. This can happen in the angina. So what are the diagnostic tests we can perform for the checking of the difference between the angina and other diseases? We can perform EKG or ECG, electrocardiogram, and stress test. Given here, you can see stress test is checked by using this machine treadmill, and with using electrocardiogram, recording of a machine, blood pressure cuff is there, and you can see stress test and blood test can be done with troponin and other keratin kinase. Chest x-rays can be done, coronary angiography or angiography can be done, cardiac catheterization can also be done, computer tomography, angiography, CT scan can be done of the heart. So these are the major diagnostic tests we can perform. And how can we prevent angina? By using following steps, by working on the following steps. So stop smoking and avoid secondhand smoke. Eat healthy meals, low and saturated fat, trans fat and salt, and control hypertension or high blood pressure and high cholesterol levels. Avoid extreme temperatures, avoid strenuous activities, strenuous activity should be avoided, and learn to relax and manage stress. Call doctor if angina changes happen. So we have finished the second part of angina. We will discuss the third part about the treatment of angina.